MRes in Clinical Research is designed to promote the research knowledge and skills of clinicians who work in the National Health Service. So the point of the program is to help them understand what research is, how to actually undertake and conduct a good piece of quality research, and how to use research to inform their clinical practice.
For me, professionally, the paramedicine industry isn't well researched. With 2 decades of experience clinical, I'd managed to maintain an interest in research for a good 15 of those years. And I just saw that MRes being an opportunity to bring together that clinical experience, put an academic bent on it, and actually then lead the profession forwards. That's why I chose an MRes, not a Master's in Clinical Studies, but a Master's in Clinical Research.
The subjects that are covered in the MRes Clinical Research span from introductory through to advanced research methods, study designs and analyses, but also give the clinicians the opportunity to actually participate and learn more about research. The second unique feature is one of our modules, CRM 001, which is called a research work-based placement. And this gives the students a unique opportunity to actually visit another site. So they choose a research project or a team that either has expertise in a speciality or a methodology, and they spend a term based with that research placement. Clinicians who are coming on the MRes really need to think about why they're looking for this opportunity for themselves. So they need to be able to articulate really clearly how they think this program will develop themselves, but also how they think they're going to use their learning after they've finished the MRes. The next thing to consider when writing your personal statement is providing an outline of the research proposal. So what we're looking for is evidence of background reading, that you can identify where the evidence is and where the gaps are, and that you can justify the research that you want to undertake.
The Masters actually opened my eyes to my capability academically, professionally. It's quite entertaining when people that are relatively inexperienced within paramedicine come to you and say, I've seen this in practice, what do you think is the better way forwards? With the MRes under my belt, I can look at things quite intelligently, I'd say, sort of quite academically, and point people in the right kind of directions.
We're one of a handful of universities in England that has NIHR funding for clinicians who come on the MRes here at City. And what that means is clinicians can study the MRes and continue to be paid their clinical salary, and also their tuition fees are paid.
I'd say to anyone considering doing the MRes, do it. Professionally, it opens doors. Personally, it challenges you to a new level. The academic world is not one to be sort of feared, and I think that's what a lot of people approach Masters level education with. I can't do that. Actually, an awful lot of people can that haven't tried, so go for it.